Good morning, good afternoon, good evening from wherever you're watching from. Thank you for taking your time to watch this video. In today's video, we'll look at the outbreak investigation process, but first, let's define an outbreak. The World Health Organization, or WHO, defines it as the occurrence of cases of disease in excess of what would normally be expected in a defined community, geographical area, or season. Before the process kicks off, of course, there's a team, or the task force. Let's see what or who the Outbreak Investigation Team comprises of. If an outbreak is suspected, an Outbreak Control Team, or OCT, should be convened to conduct the investigation with the following represented in the membership. 1. Consultant in Communicable Disease Control, or CCDC, Consultant in Health Protection, or CHP. 2. Public Environmental Health Officer, or PHO/EHO. 3. Consultant Microbiologist or Virologist. 4. Secretarial Administrative Support, with consideration of 1. Regional Epidemiologist. 2. Media Press Officer. 3. Infection Control Nurse. 4. State Veterinary Service. 5. Food Chemist/Microbiologist at Food Standards Authority. 6. Toxicologist. 7. Director of Public Health. 8. Water Company. The Outbreak Investigation Process. There are many processes that may be highlighted as the ideal process for investigation of an outbreak. A simple 5-stage process includes 1. Confirmation of the outbreak. 2. Case definition. 3. Generate hypothesis. 4. Test hypothesis. 5. Action plan. But since our main goal in this channel is to thoroughly and comprehensively educate, we'll focus on a 10-point process of outbreak investigation. The steps include: Step 1. Confirmation of the outbreak. This stage answers the following question. Is there an increase in the number of cases expected in the population, time, and place? To confirm the number of cases, interviews with the affected individuals are conducted, and laboratory findings are thoroughly reviewed. Is further investigation needed? The extent and urgency of the investigation should be considered. Step 2. Verify diagnosis. This step involves obtaining medical records and laboratory reports, repeating tests if necessary, and conducting further clinical tests if needed. Step 3. Case definition. This step comprises the 5 W's. Who? The people affected, for example, age group, gender. Where? The place the outbreak first occurred. When? The time the outbreak occurred. What? The signs and symptoms. And why? The causes or factors that could have led to the outbreak. Also, how many cases are there? Step 4. Case finding. Case finding involves interviewing known cases, locating others exposed to probable risk factors, or rather, contact tracing, reviewing routine surveillance data, notifications and laboratory results, and contacting other healthcare workers. Step 5. Descriptive epidemiology. Descriptive epidemiology focuses on person, place, and time, meaning the personal characteristics of the cases, changes in disease frequency over time, and differences in disease frequency based on location. Characteristics of person, place, and time are essential elements for both descriptive epidemiology, to identify possible sources, and for analytic epidemiology, to definitively identify the source. As cases are identified, it is important to record information systematically and organize it in a way that makes analysis much easier. What information should be collected? Personal information, such as name, address, phone number, age, sex, race, and occupation. Signs and symptoms, as appropriate for the type of outbreak. For example, for hepatitis A, one would record the presence or absence of symptoms like fever, nausea, vomiting, anorexia, and fatigue, and relevant signs like dark urine and sclera jaundice. These details will be helpful in confirming the diagnosis and determining that the subject meets the case definition. Laboratory test results and relevant exposures should also be documented, such as sources of food, especially ready-to-eat or uncooked food, and water, including restaurants and cafeterias, and sexual contacts. When interviewing cases, this information might initially be entered onto a case report form or a questionnaire, but it will later be entered into the line listing. Data collected is presented in an epidemic curve, which is a graph of occurrences of cases over time. This can help determine the nature of the outbreak, point, common, source, propagated, continuing source, or point source, and person-to-person spread. Additionally, a line list is used, which is a table summarizing the information about persons associated with the outbreak. Each row represents a single individual, and each column represents a specific characteristic. Identifying information, demographics, dates of illness results, pertinent risk factors, exposures, and clinical details or lab results. In this video, we have covered step 1 to 5 of the Outbreak Investigation Process. We'll cover step 6 to 10 in the next video, which will be up soon. Thank you for watching. Watch out for part 2.